What if I told you that the number you feel most comfortable about might be the one putting you at risk after 60? Most people look at their blood pressure, see that bottom number sitting nicely in the normal range, and they relax. They think they're safe. But after 60, your body changes, your arteries change, and the number that used to matter most quietly loses its importance. I've had patients sit right in front of me, completely reassured by a good reading, while another number was telling a very different story, a dangerous one. And the hardest part is, you don't feel it happening. No warning, no symptoms, nothing obvious. Today, I'm going to show you which blood pressure number actually matters after 60, why it changes with age, and what you need to start paying attention to before it's too late. Many people trust what they have always been told. They focus on one number and ignore the other. But the body after 60 does not follow the same rules anymore. Here is what most people miss. The top number begins to rise as arteries become stiff. The bottom number may stay normal or even drop. This creates a gap that silently strains the heart and vessels. It is not just about pressure anymore. It is about how that pressure moves through aging arteries, and that changes everything. I have spent decades treating patients with heart disease. I have seen how small misunderstandings lead to big problems. People come in feeling fine. Their readings look acceptable at first glance. But when you look closer, the pattern tells a different story, one that often gets overlooked in routine checkups. There is a simple shift in thinking that can change how you see your blood pressure after 60. Once you understand this, you start noticing what truly matters, and that awareness can make a real difference. I had a patient once, 67 years old, sitting across from me. He looked calm, almost confident. He said, "Doctor, my blood pressure isn't that bad. The bottom number is always normal." And I hear this all the time. People fixate on that second number like it's a safety signal. If it looks good, they assume everything else must be fine. But here is where things start to go wrong after 60. That same reading you have trusted for years does not mean the same thing anymore. When you were younger, the bottom number carried more weight. It told us how your blood vessels were handling pressure between heartbeats. But as your body ages, the system shifts. Now the top number becomes the one that tells the real story. The top number shows how much pressure your heart creates when it pushes blood forward. And after 60, your arteries do not respond the same way they used to. They do not absorb pressure as efficiently. So that top number starts to rise, sometimes slowly, sometimes without being noticed, and this is where it becomes dangerous. The bottom number can stay normal at the same time. So you end up with a reading that looks reassuring at first glance. One number looks fine, but the other is quietly increasing your risk. This pattern has a name. It is called isolated systolic hypertension. High top number, normal bottom number. And many people do not even know it exists. They feel normal, no symptoms, no warning signs. So they keep thinking everything is under control. But inside the body, the pressure pattern has already changed. And this is the part most people never get told. The same numbers, the same machine, but a completely different risk. And if you are still judging your safety based on the bottom number alone, you may be missing the one signal your body is trying to show you. Let me explain why this happens, because this is the part most doctors never fully explain. Think about your arteries when you were younger. They were flexible, soft, almost like elastic tubes. Every time your heart pushed blood forward, those arteries would gently expand. They would absorb part of that pressure, then slowly release it as the blood moved through your body. That flexibility acted like a shock absorber. But after 60, that system begins to change. Over time, the structure of your arteries shifts. The elastic fibers that once allowed them to stretch start to break down. In their place, more rigid material builds up. The result is simple. Your arteries become stiffer, not blocked, not necessarily damaged in the way people imagine, just less able to move. And that one change affects everything. Now, when your heart pumps, the arteries cannot expand the way they used to. Instead of absorbing the pressure, they resist it. So the force of that blood gets pushed forward more sharply. That is what drives the top number higher. At the same time, because the arteries are not holding that pressure between beats, the bottom number can stay the same or even drop slightly. So you end up with a strange pattern. And that's exactly where most people get misled. And most people think, well, that looks okay. But what you are really seeing is not a normal system. You are seeing a stiff system, a system that has lost its ability to cushion pressure. I often describe it in a simple way. Imagine pushing water through a soft hose versus a hard pipe. The soft hose expands and absorbs the force. The hard pipe does not. The pressure spikes. That is exactly what is happening inside the body. And this is why it is not just about numbers anymore. It is about how your blood is moving through arteries that no longer behave the same way. A woman came to see me a few years ago. She was 71, sharp, independent, still driving, still active. She told me she felt completely fine. No pain, no warning signs. Her blood pressure readings did not alarm her either. The bottom number looked normal, so she assumed everything was under control. But when we looked closely at the top number, it had been sitting high for years. This is where the real danger begins, because this kind of pressure does not cause symptoms early on. It works quietly, slowly, and it affects the smallest, most delicate blood vessels in your body first. In the brain, that constant high pressure starts to damage tiny vessels, not enough to cause an immediate stroke, but enough to create small, repeated injuries over time. These changes build up, and years later, they can show up as memory loss, confusion, or what many people are told is Alzheimer's. But in many cases, it is actually vascular damage that could have been slowed or prevented. In the heart, the effect is different, but just as serious. Your heart has to push against that higher pressure every single beat. Over time, the muscle begins to thicken. At first, it seems like a strength response, but eventually, that thicker muscle becomes less efficient. It cannot relax properly. It cannot fill the way it should, and slowly, this can lead to heart failure. Then there are the kidneys. They rely on very fine blood vessels to filter waste from your body. High pressure damages those filters gradually. There are no early symptoms, no clear warning signs, but over time, function declines. And by the time it is noticed, much of the damage is already done. Even the eyes are affected. Those same delicate vessels in the retina can become damaged, increasing the risk of vision problems. This is why I say this is not just a blood pressure issue. It is a whole body damage system. And the most concerning part is that it can be happening for years while you feel completely normal. I remember a gentleman, 72, who told me, "Doctor, I thought higher pressure was just part of getting older." That belief used to be very common. Many people were told that a higher number was normal with age, something to accept, not something to act on. But that thinking has changed. We now have strong evidence showing that lowering the top number, even after 60, makes a real difference. It reduces the risk of serious problems. It helps protect the brain, the heart, and the kidneys. So the goal is no longer to simply accept higher numbers. The goal is to manage them more carefully. For most people, that means keeping the top number below 130. Now here is where many people get confused. They think this can be fixed with just one small change, maybe cutting a little salt, maybe walking once in a while. And while those things do help, they are only part of the picture. As we discussed earlier, the underlying issue is structural. The arteries have become stiffer. So the approach needs to be consistent and combined. Reducing sodium becomes more important because the body handles salt differently with age. Even small amounts can raise pressure more than before. Weight also plays a direct role. Even modest weight reduction can help bring the top number down. Regular movement, especially simple aerobic activity like walking, helps the blood vessels function better. It supports what flexibility is still there. And stress matters more than people realize. When stress hormones stay elevated, they keep pressure higher throughout the day. But here is an important point many people struggle with. Medication is not a sign that you have failed. In many cases, lifestyle changes alone are not enough to fully control the top number. Because the issue is not just behavior, it is also physical change inside the arteries. Medication becomes a tool, a protective layer, something that reduces risk while you continue supporting your body with daily habits. And one more thing that often gets overlooked: how you measure your blood pressure matters. Readings taken in a clinic can sometimes be higher because of stress, or, in some cases, normal in the clinic but higher at home. So, relying on occasional readings can be misleading. Regular monitoring at home gives a clearer picture. It helps you and your doctor see patterns early and respond before problems develop. This is not about doing one thing perfectly. It is about making steady, informed adjustments that match how your body works after 60. There was another patient I remember clearly, early 70s, very disciplined. He would check his blood pressure at the clinic every few months and felt reassured each time. "It's always fine when they check it," he told me. But something did not add up. His readings at the clinic looked acceptable, yet his overall risk profile suggested otherwise. So I asked him a simple question. "Have you ever checked your blood pressure at home, consistently?" He hadn't. This is where many people unknowingly miss what is really happening. Blood pressure is not a fixed number. It changes throughout the day. It responds to stress, movement, sleep, even small daily habits. A single reading in a clinic does not always reflect your true pattern. There are two common situations most people are never told about. The first is when your blood pressure appears high in a medical setting, but is actually lower at home. That is often driven by stress in the clinic environment. The second is more concerning. Your readings look normal during checkups, but at home, in your real daily life, the numbers are higher, quietly elevated, repeated again and again without being noticed. Without regular tracking, both of these patterns can go completely unnoticed. So we asked him to start measuring at home. Same time each day, calm setting, consistent routine. Within a week, the pattern became clear. His top number was consistently higher than what we saw in the clinic. That changed everything. Because now we were not guessing anymore. We were seeing his real blood pressure, the one his body experiences every day, the one that actually determines risk. This is why consistent monitoring is not just a routine task. It is how you uncover what is otherwise hidden. It allows earlier decisions, more accurate adjustments, and it helps prevent that long period where damage builds quietly without being detected. Let me walk you through a simple way to approach this, step by step, without overcomplicating it. First, shift your focus. When you look at your blood pressure reading, pay close attention to the top number. Do not ignore the bottom number, but understand that after 60, the top number carries more meaning for your risk. That one mental shift changes how you interpret every reading you see. Second, begin tracking your blood pressure at home. Choose a quiet time each day. Sit comfortably. Stay consistent with timing and position. Do not rush the process. Write the numbers down or store them in your device. What matters is not one reading, but the pattern over time. Third, look for trends, not single values. If your top number is repeatedly elevated, even if the bottom number looks fine, take that seriously. This is how isolated systolic patterns are identified early, before they lead to larger problems. Fourth, support your body through steady daily habits. Reduce your salt intake in a consistent way. Small changes here can have a stronger effect after 60. Pay attention to weight. Even modest reductions can help bring the top number down. Stay active with simple, regular movement like walking. And be aware of stress levels, because ongoing tension keeps your pressure elevated longer than you may realize. Fifth, understand the role of medication clearly. If your doctor recommends it, it is not a failure. It is a protective step. Because the changes in your arteries are structural, not just behavioral, lifestyle alone may not fully control the pressure. Medication helps reduce the strain while you continue supporting your health with daily habits. Finally, stay consistent. This is not about doing everything perfectly for a few days. It is about building a routine that reflects how your body works now. Small, repeated actions over time create the biggest difference. And most people only realize this after something has already gone wrong. Over the years, I've sat across from many people who believed they were doing everything right. They took their readings, they listened carefully, they followed what they thought mattered, and yet something small was being misunderstood. Not because they were careless, but because no one had explained how things change after 60. That is the part that stays with me. Because the difference between feeling safe and actually being safe can sometimes come down to understanding one number the right way. And I've seen what happens when that understanding comes too late. I've seen the surprise, the frustration, the question people ask when they realize something was quietly developing in the background. Why didn't I know this earlier? So, if you take anything from this, let it be this. Your body is not failing you, it is changing, and those changes require a different kind of attention. Not fear, not panic, just awareness. Because when you understand what your body is telling you, you are no longer guessing. You are making decisions with clarity, and that changes how you move forward. This is not about perfection. It is about catching things early enough that they never become something bigger, and that is always worth it. Let's bring this together in a simple way. After 60, your blood pressure does not mean what it used to. The bottom number is no longer the main signal. The top number becomes the one that tells the real story. And if that number is quietly rising, even while the bottom number looks normal, the risk is still there. This happens because your arteries change. They become stiffer. They lose that soft, flexible ability to absorb pressure. So the force from each heartbeat moves through your body differently. That is why the top number goes up and the bottom number can stay the same. And the effects are not limited to one part of the body. This pressure pattern can quietly affect the brain, the heart, the kidneys, and even the eyes over time, often without symptoms, often without clear warning signs. The good news is that once you understand this, you can respond earlier. You can track your numbers at home. You can focus on the patterns that actually matter. You can make steady adjustments in your daily habits. And if needed, you can use medication as a protective tool, not as a setback. So here is a simple question for you. When you check your blood pressure, which number have you been trusting more? If this gave you a new way to look at your health, consider sharing it with someone close to you. And if you want more simple, clear explanations like this, you can subscribe and stay connected. And just a quick note before we finish. This information is meant to help you understand your body better. It is not a replacement for personal medical advice. Always speak with your doctor about your specific situation, your readings, and what is right for you.